We're going live. All right. Good morning, everyone. Good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center here in the amazing city of Mansfield, Texas, not too far from Dallas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm excited to be here with you again this Thursday morning to discuss topics in line with what we are all about. And this topic is one of the things that's very near and dear to my heart. And I'm very happy and honored to have Dr. Marissa Toussaint with us this morning. How are you doing, Doc?
I'm great. Thank you. I'm so happy to be here.
And nice to meet you.
And nice to meet you.
All right. Now, for those who are watching live, hashtag live. Those of you who are watching replay, hashtag replay. And that being said, Doc, can you kindly introduce yourself? Who are you and what do you do?
Sure. So, excuse me. I'm Marissa Toussaint. I'm a family physician, board certified family medicine, board certified in obesity medicine, and also a specialty or field called culinary medicine. I have certification. I'm the owner of a practice in New York City, in Brooklyn, called Anise Medical. And so I have a small micro practice that with a direct primary care model, and I take care of patients and from a holistic standpoint. And so food and medicine are two of the tenets that I really focus on, as well as all of the other lifestyle pillars.
I love it. I love it that you can use food as medicine. And essentially, I think that's how food is supposed to be for us to nourish us, to help us fight off diseases. I think that's the original intent. So I'm
Yes.
glad we're having this conversation. But I'm curious, how did you delve into this as a niche? Is there a story behind it? What was it for you?
Yes, I think the issue is that as a family physician, I felt a little bit underprepared. Maybe 5, 10 years into practicing as a general family doc, I felt that I needed a little bit more guidance to meet what I saw as a sort of crisis of chronic diseases in the
Mm,
patients that I was coming across, and I wanted additional skills to help me sort of balance this, right? So in our traditional training, we're taught to manage diabetes, manage
mm,
hypertension, but we're given very little. Like we can pick the right medications, and there's some very wonderful
mhm,
treatments that are out there that are very effective. But on the other hand, I felt a little underprepared to kind of, I would have patients say, "But doc, what can I eat?"
right.
But what can I eat? And that's when sort of the light bulb went off. I had a colleague who did training in culinary medicine,
Mm,
and I was sold. And I love to cook.
mm.
I'm a foodie, so yay! And so that was it for me. I was sold. So I went and did that training, and then subsequently also got additional training in obesity medicine, which I feel is also very helpful and relevant to the patients and the community that I'm serving.
Awesome, awesome. So, and I love that you're a foodie too. And I love that you kind of throughout the journey of medicine, and I can relate to the fact that in med school, and even after once I had graduated and started practicing medicine, I used to feel guilty. Like I felt I was doing a disservice, and I thought I was the only one.
Hmm.
And then to find out there's a whole community of doctors and clinicians who are trying to use natural methods and foods as medicine as a whole emphasis was so exciting. So I'm glad you share that. And my next question is this: I have some people who are watching who are like, "Yeah, right. Food is medicine."
Yeah.
Can you maybe give examples of how it is possible to use food as medicine and ways that you've used that even in your own practice?
Sure. So I think we're talking about hypertension today, and so one of those were like the one of the best examples I think is something called the DASH diet, right? And DASH stands for Dietary Approaches to Stop Hypertension.
Mm,
DASH. And this is a diet that's been around for and studied, well studied for over 20 years. And so if you don't believe that food can be medicine, the initial study took over 400 patients and compared people who were on a traditional, like what we call the standard American diet, and gave one group fruits and vegetables, and then they gave another group the full, what we call DASH diet. And so the overall premise of the DASH diet is more fruits and vegetables, adding whole grains, and lowering saturated fat. So they substituted low fat dairy, and really kind of lowered other sources of saturated fat, like red meat, for instance, and followed them for 3 weeks. And no, in the initial study, there was no intervention for salt. So they just left salt
mm,
alone. You just do
mm,
regular salt, whatever you're used to. But we're changing up some things in your diet.
right.
And after 3 weeks, the group with the DASH diet had a 3 point decrease. So they had a significant lowering in their blood pressure. And when they did a follow up study and they
Right.
said, okay, well, let's do the DASH diet and address the sodium, which is
Mhm.
another word for salt. So if you address salt, lower the salt, and and change the diet towards a DASH diet, you can lower your blood pressure by up to like 6 points, which is significant without medication. That is powerful.
Yes, yes,
That's
yes.
powerful.
Yes. And for those who are watching, I don't want you to get discouraged, and I love how you mentioned the two-step process where the first one was just incorporating more fresh fruits and vegetables and kind of leaning back a little bit from the red meat and how that was doing something. So little is better than nothing. It's my encouragement to those who are watching. So don't give up. What you're doing actually adds up. All right. My next question to you now. Let's delve more into the high blood pressure. Are there foods that actually cause it to go up? And I know we talked salt, but I want us to give an example because sometimes the argument is I don't add salt to my food, and this is not to criticize anyone and make anyone feel bad, but sometimes the food already is so. So what would you say to that? Doc, I don't add salt to my food. What would you
I
say to
would
that?
I would say it would be you would be surprised at how much salt is hidden in foods. And so if you're buying fresh foods and preparing it yourself, I think that's probably the best way to know for yourself how much salt really is in there.
Hmm.
But in things like one of the ones that you'd be really surprised about is bread. And bread doesn't taste salty, but
Right.
I always encourage people to look at the label and see how much sodium is at the back. Canned foods, like frozen TV dinners, um, things like condiments, so ketchup, mustard,
Mayonnaise.
mayo, all the good stuff that you put on foods, barbecue sauce, even one that's very, I'm in a community, I'm from the Caribbean, but jerk sauce. So a
Right.
lot of those commercially prepared condiments, marinades tend to have lots of hidden sodium in them. So that would be the first thing to kind of look at. Um, the other thing, so you're asking about other foods, and this is a little bit counterintuitive for many people, but
Mm,
sugar can play a role with blood pressure, especially if you have something called insulin resistance, which is sort of the precursor to prediabetes. And even if you have prediabetes, type 2 diabetes, you've got some insulin resistance. And some people have insulin resistance before having either of those. But sugar can also play a role in the regulation of blood pressure. So it's also important to lower the amount of refined sugars that you are consuming.
mm. I'm going to harp on some of the things you said, and the
Yes.
conversation here is to kind of help people know, be more aware. So you're eating the things where you know that, okay, this is adding to my salt, so I may need to be a little more cautious about how much I use.
Hmm.
Knowledge is power. I love how you mentioned, the sauces, right? I have a Nigerian background, so we're big on the Maggi or the adobo or the bouillon,
Oh, right. Yes.
chicken
Yes.
bouillons, to the
Yes.
flavor enhancers that have the MSG, and it's usually loaded with salt,
Yes.
and the soy sauces. I was actually talking with a patient this week, and I had encouraged her to eat more beets to help with her iron, and also maybe help with lowering blood pressure. And she said, "Yeah, I eat the canned beets." And I was like, "Well, the canned is salted to preserve it, so it
Mhm.
defeats the purpose. So really knowing what's in it is very, very important as well. So thank you for highlighting that. So next question for you is, um, what foods can actually decrease blood pressure? For someone who's watching, like, all right, fine, I get it. I'll watch the salt, blah blah blah. But what foods can I start adding in? I know we
Mhm.
mentioned fruits and vegetables earlier, but can you give me more specific ones that I can use to lower my blood pressure?
Yeah. So, leafy greens, whole grain. So those are like brown rice, whole wheat, quinoa, amaranth, um, barley. Those are some of the good whole grains, and lots of foods that have fiber. So there's kind of a there are multiple layers in like the mechanism that is lowering the blood
Blood
pressure, right?
pressure.
So one is the fiber, like you want to increase the fiber, so foods that have lots of fiber are helpful, and so your greens are going to help you with that, but also things like sweet potatoes um, are have a lot of fiber, and people aren't often aware of that. And then you want foods that also have potassium and calcium and magnesium. So those have like blood pressure lowering capabilities as well. So bananas, so a lot of your fruits, a lot of the vegetables will also have some of these as well.
I love it. I love it. I love it. I love it. Now, for someone who's watching, who's like, "Yeah, this is wonderful, doc." Like, yes, I get it, but I work a lot. Can't make my own meals. I go out to eat, and we're in Texas.
Hmm.
We're in Texas, sis. So, um, we've mastered food engineering here. Do you have
Yeah.
any tips for people who are like, I eat out a lot. I don't have the luxury of time. Are there any little tips you give us that eat out? Like, what should I do?
Yeah. So, but clarify for me first. In New York City, in some restaurants, we have nutrition information at some of our at many of our restaurants. Is that the case as well?
To a certain degree, I'll be honest with you, I don't eat out much, so I don't. But I know that they put the fat content, and I should look closely to see how much whether they put the salt. But that's a good tip because by
Yes.
law they're supposed to be exposing those things. So you it's like they told you that what amount of salt was in it, and
Yep.
you ate it on your own. Your own.
Yes.
Um,
So that's one thing you could do. But let's say that's not available or not an option for you, right? The easiest thing you could do is to add a salad to whatever you're ordering, right? If you fill up your plate, half your plate with a salad, or vegetables of any kind, that is going to help you. Because remember what we said, there's still benefit to fruits and vegetables,
mm,
even if you can't control the sodium, right? So, the one hack you can do without, even if the sodium is not in your control, is to balance the things that you do have control over, and those are the fruits and vegetables. You can have an extra salad. You can look at the side orders to see which ones have
mm,
some of the
mm,
foods that we talked about. Other things that are helpful, nuts have healthy fats, and so those are also a feature in the DASH diet, nuts and seeds.
mm,
And so, kind of look through the menu to see, I wonder how I can get my
mm,
servings of fruits, vegetables and whole grains. You may not get all in one. That's okay.
Right.
That's okay.
Right.
But if you commit to saying, I'm going to have at least one or two servings at this meal and really make an effort to for that to happen, then I think that's a good compromise.
Thank you, and I like that. Now I have a bonus question. So I have
Yeah.
someone who's asking, yeah, what's with you guys and salt? Like salt is essential to enjoying my meal,
Yeah.
and the idea of a saltless meal is daunting. Do you have any tips for that?
Yes.
That
So
should help us.
salt is highly pleasurable, highly addictive, and cheap. And that's the reason why it's sort of ubiquitous. It's everywhere. If salt costs as much as herbs and spices, then
Mm,
it might not be used in commercially prepared foods to the extent that it is. But to answer the question, I would say starting to experiment if you're someone that cooks, using lots of herbs and spices. Fresher is better, but if you can't, then you can use like the dried powders. Sometimes I work with patients and tell them how to make their own dried seasonings, so you could do that. But really playing with the flavor of things is a way to help reduce the salt. And too much salt is really kind of a shock to the kidneys, and
mm,
that's why it plays a role with the blood pressure. So it's not that we want no salt, but we want to have the amount of salt that is not that is the least damaging to kidneys. And the overall recommendation is that you keep it below 2 grams, 2,300 milligrams of sodium in a day, which is literally a teaspoon. So if you take a teaspoon and put salt on it and fill the teaspoon level, not
no,
heaping,
um,
level teaspoon, that's your sodium intake for the day.
um, um,
So if you keep that mental image in your head and kind of as you go through the day, then that kind of should help you picture how much sodium we really need to have. But two things I would say: herbs and spices really boost the flavor, and over time, you may notice that the salt,
mm,
you need less salt,
mm,
and you can gradually reduce salt over time. So I usually say go down by a quarter teaspoon in any recipe. So like if you had a recipe you made like a big pot of beans or chicken, and you're used to using a teaspoon of salt for that particular dish. First of all, we should always be measuring the amount of salt that we put in. Just so you
mm,
know, even
mm.
if nothing changes, just so you know, just start measuring so you know what you're actually consuming. Um, and then if you're starting from 1 teaspoon, then maybe you want to go down by quarter teaspoon the next time you make the dish. And then you can gradually decrease it over time. The other thing that happens is our taste buds adjust
Yes, they do.
over time. Don't
Yes, they do.
trust me, this will happen. Your taste buds will adjust over time. You can't go from A to B necessarily. That may be impractical for many people. But if you decrease the sodium over time, your taste buds will adjust.
Yes, yes, I love it. I love it, and I've seen that happen in my life as well. Just in the salt. And one more tip I was going to add is if you're gonna, for those of us who are big rice fans, boy
Uh huh.
rice, add the little olive oil, little cilantro to give the flavor like you talked about, and then add the salt when it's almost ready. So that we don't
Yes,
need to put as much. Okay,
I
and it
do
still
that
has
also.
its yeah. So it's
Yeah.
this is powerful. This is powerful. Very,
Yes.
very, very practical. I love it. I love it. And Doc, I have people who are watching who are like, man, this lady, I like her. I like how she explains things. I like how she's able to empower her clients to use food as medicine. Doc, where can people find you?
Yeah. So I have an Instagram and Facebook account, and both of them are under the The name is at Anise Medical, ANISE, like the spice, MEDICAL.
And I'm posting it here so we can see that those of you who are watching on YouTube and those who are watching on Facebook,
Yes.
there's the link so you can connect with Dr. Toussaint directly. Doc, I really appreciate you for coming. I have comments in the post here saying very good conversation. Love the discussion. Has been very, very helpful. Thank you so much.
Thank you. And thank you so much for having me. I appreciate it.
Oh, my pleasure, my pleasure. And thank you all for watching. Those of you who watch live, those who watched a replay, please, as always, share this. I'm sure you know someone who has high blood pressure. Share this as a way to help them lower their risk for heart disease and other things. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, near Dallas, Texas area, I am she. Have a blessed one, everyone. And thank you again, Doc, for joining.